The first test to discuss is the prothrombin time, or PT, or pro time. This is going to measure extrinsic factor, which is factor 7, and the common factors. If these factors are low or deficient, then the PT is going to be prolonged or increased, which means it's going to take longer to clot if that level is higher. Causes of prothrombin time or PT increase include liver disease, because that's where we're making a lot of these clotting factors, obstructive biliary disease, which blocks the bile needed for the absorption of the vitamin K dependent factors, and the oral anticoagulant warfarin or Coumadin, which blocks the production of vitamin K dependent factors. Now we have our schematic and we have highlights over what PT is measuring. So we're always measuring the common pathway, which is going to be 1, 2, 5, and 10, plus extrinsic, which is factor 7. Here's a lab report for a PT value. We see at the bottom, highlighted in purple, we have the prothrombin time at 9.9, which is within the normal range. Now, if you notice, the reference interval for PT on the lab report is 9 to 12. Listed in the heading, it's 11 to 15. There are many different assessment techniques, and each lab may have a slight variation in its range, but we use the PT to titrate someone's Coumadin, to titrate their medications to prevent clotting in patients who have had strokes or have prosthetic heart valves or have a state of hypercoagulability. So we need to normalize that ratio. We need to normalize that number, and therefore we create a ratio. And that's what the INR is. So let's move to the next slide and learn about the INR. So the INR is this uniform comparison measurement that we can use that's independent of labs and assessment tools, such that if I order an INR in location A, it means the same as the INR in location B. I don't have to worry about different assessment techniques, different labs that I would if I ordered like a CBC in my in-house CBC machine versus sending it out to LabCorp. The range of INR, the normal INR, is 1. The higher the INR, the more likely the patient is to bleed, the less likely they are to clot. The condition that we're treating is going to dictate the INR goals. If we're treating a patient with a prosthetic heart valve, the INR goal is higher at 2.5 to 3.5. If we're treating atrial fibrillation, the INR goals are 2 to 3. We can, of course, send a venipuncture sample to detect the patient's PT and INR, but we can also do point-of-care testing, which means right here and now. This can be done in the office with a quick finger stick, and even can be done for at-home testing.